Hey people, welcome to the topic of today. I know we're gonna have an interesting topic today, and I'm trying to figure out how to broadcast images, and it's becoming a problem. Let me see if I can broadcast. Select that one, then we continue. We see how we can broadcast. Some greetings, Mumbwa. Today we are talking about um, something called conventional. You know, people are used to what they call herbs, but there is a difference between herbs and the main treatment that we use as traditional medicine. So we will have some discussion on how these things go hand in hand, how these things it's not that, for long people thought that uh, doctors don't like herbal medicine. No, there is a different meaning when it comes to herbal medicine and some conventional. When I'm talking to when I'm saying this is conventional medicine, we want to discuss, we want to understand. Let's understand between herbal medicine and when it comes to traditional medicine, it doesn't mean only herbs. We have very many forms of herbal of medicine. You understand? We have so many different parts of medicine that people use and they are traditional. So today we are going to discuss about uh, medicine that is traditional and medicine that is herbal. You see, so we don't only talk about herbal medicine as a part of sorry, as part of traditional medicine. We have a lot of types of medicines that we use, and we will see. So today, when I'm talking about conventional medicine, when I'm saying this is conventional medicine, I mean the medicine that we use in hospitals. And when I say complementary medicine, you just understand. I think there are some things I have to pin. We are talking about conventional medicine. Wait, conventional medicine. Conventional medicine. That is one. I want to pin them so that people can understand what I'm talking about. That is medicine that we use in hospitals. And then we have the other one, which is complementary medicine. So let's see what is complementary medicine. Complementary medicine. Okay, just a minute. Complementary medicine. I'm trying to source out. mm, I'm trying to source out some images so that today we can learn and know what is the difference between herbal and do as doctors use these herbs. So it is sometimes it becomes so chaotic when some people say I'm using herbal medicine, and then you go to the hospital. Then a doctor starts to say, we did tell you to use this. We told you to use this medicine. Now today is that day that we will discuss and know that how do we balance between herbal medicine, traditional ways of treatment, and our current ways of treatment. Now, I've started by saying this. There is complementary medicine, and I've written there, medicine refers to health care practices that are used together with conventional. Conventional, I've said, is the drugs that we use in hospital. Now, when we talk about herbs, we don't talk about only herbs. There are some practices that I'll go faster about them, so that are used for healing, for the purpose of healing, and they are traditional, that we don't use in hospital. You get it? That's why we take all of them. We take all of these practices plus the herbs. We call them complementary medicine. Complement, and some, you will find that sometimes these complementary medicines, they are integrated, they are assimilated with the drugs that are used in hospital for better health sources. Now, when we come to complementary, first, yeah, first, welcome everyone who is listening. And today I know I will have so many questions. Please bring them. We understand each other and we go on. Now, conventional medicine is the mainstream medicine system practiced by trained healthcare professionals such as doctors, nurses, pharmacists, nutritionists, public health officers. That is called conventional medicine. Use scientific, they only use, you see, when you are a doctor and you are in hospital, for you to defend yourself, use scientific tested treatment. The treatments that have gone through laboratory, they have been tested. When you are given this drug, they know this is how it will react to your body, and if it is an overdose, this is what we can give to bring it down. And this refers to this. You see, it's not only medicine. I want you to understand, when we come to treatment, we talk about the algorithm of treatment. Everything. We talk about everything. Here we talk about drugs, surgery, radiation therapy for cancer people, and vaccination. We will go to traditional medicine and we will see, but we are dealing with this as assimilation. We want to see how drugs that are new era and our forefathers, how they come together, and we will see which kind of drugs that we used to use, our forefathers used to use, that are being used today. You get it? Now, we have something called vaccination. That is conventional medicine, but focuses on diagnosis and treating the disease using laboratory tested and imaging. You cannot just be given, let me say, what do we say? Some chemotherapy or radiotherapy, and you've not done an MRI imaging and the biopsy to confirm this is cancer. This is conventional medicine. It has all some advantage. Advantages is it is evidence based, effective for emergency and serious illnesses, and standardized treatment protocols. But here we cannot assume our forefathers. Our forefathers were brighter than us. They knew everything, and they started the science of treatment. They knew this is the drug of choice for this. This is where we go to something called complementary medicine. Complementary, our traditional medicine itself. You see, complementary medicine refers to non-mainstream practice. You get it? Non-mainstream practice, and together with conventional medicine, not as replacement. You get it? As I talk, I cannot use a drug of a traditional. We respect our forefathers, but we cannot replace a drug by, let me give an example of a diabetic patient. You cannot replace herbs by antihypoglycemic agents like metformin. No, we continue examples of these herbs and traditional medicine. We will see even some herbs that treat these people, how they help us. We have something called herbal medicine. Now we are in traditional practices. We have the, just like the complementary medicine that we talk about. Here we have some drugs that it's a protocol and then diverse thing. We have herbal medicine. We have acupuncture. Acupuncture. You sometimes when people are sick, some traditions heal by pinning, yeah, giving some pins on your body so that you can heal. And then we have massage therapy. Massage started from way back, where before. We have yoga. Yoga is a tradition. We have mediation. Mediation is a tradition. Cryopractic, cryopractic therapy. You understand? Those that before traditions were using some when you are sick, they play around with your bones, they chiropractic it, and you feel better. Traditional healing practices, like in Africa, we saw in parts of South Africa, we have something called a sangomba. This is an overview. I'm kind of like giving the difference between the herbs and the main, so that we can go down and see how these herbs started. Now, the key facts that we should see in complementary, where we start by herbs, chiropractic, mediation, yoga. You see, often focuses on holistic care. It focuses on holistic care. South Africa. If there is any South African who will tell me, you will see this, or Kenyan, you will tell me in South Africa they call them a sangomba. Sangoma. That person will try to play with your mind. This person will speak out some things. This person will cuss out some things. This person will take some herbs in a steamy room. He'll do some things, and then when you are there, your mind has come back and you believe you've been healed. You get by the spirit. So when I say it is holistic care, when I'm telling you that it focuses, the traditional medicine focuses on mind, body, and spirit, I'm talking about the traditional healing practices like acupuncture and cryopractice and traditional healing practices. Yes. And the spirit, you go from a sangoma when you feel that I'm healed and that person has helped me to remove the bad spirit. Holistic care, mind, body, and spirit. Remember, this is not conventional. This is complementary. Our forefathers gave us to us. They taught us, if you take this leaf, your stomach pain will go away. If you take this leaf, if you have fever, it will subside. We are going to look at those things in relation to the brain drugs that we use in hospital, and how they assimilate and how they are integrated today. Now, if we don't finish this topic today, we will go on and on and on. Remember, the presenter, the doctor, is Benjamin, the wise guy, a friend to all, a love of a person who likes love and no chaos. So please bring your questions. Let's interact. Tell me the practice that you have in your home and the traditional practices. Let's have the discussion. Yes. Now we go to the second part. We have said the traditional healing, the herbs and the process, it focuses on holistic care, holistic mind, body, and spirit. And then we go to frequent use for pain relief. Most of the herbs that the traditional forefathers passed on to our generation, they focused on pain relief, stress reduction. You know, stress is a bad thing. It kills you slowly. So stress reduction and improving well-being of your body, to live in harmony with your body. And then we go to another one. Many methods are based on traditional and cultural practice. Shh, don't say that. Don't. Many methods that we use in our hospitals, yes, they are based in our traditional practices. When I started studying medicine, my grandmother used to say, when you give me a baby, please give me the baby on the right hand. So in my mind, I was like, oh, the right hand means she wants this baby to live the rightful life. No, it is medical. When I started medicine, I understood it is medical. Why? Because when you give your grandmother, you take the baby in your right hand, what happens? the stomach, if this baby has fed, eh, food will not regurgitate and this baby will not vomit. You get it? You get it? Our forefathers were clever and they knew it. Because of what? Because of practicing and experience. You cannot overrule a word of a person who is experienced. And our forefathers were experienced. So I came to realize, oh, this thing is medical. This thing is medical. So every time I carry a baby, I carry that baby on the right hand so that the left side balances on my body and the stomach lies down so that this baby cannot get regurgitation. So the method, traditional method, focuses on cultural practices. That is a culture. Give me the baby on the right side. It is a culture. You see. Now, some have scientific evidence, but both have limited research. Note that down. Some of these practices have scientific evidence, but have limited research. Because when it comes to research, the kind of money, resources, time that someone can use. You get it? So let's think. What is the advantages? Remember, we are just having a review and we focus on introduction of this topic. This is a very big topic. Everyone who is watching, I know where you are, you have your cultural practices wherever you are. Please give me one as we go, and then you find out that, oh, this is our culture. Now we will know how culture and our medicine, conventional medicine, interact. Now, advantages. What are the advantages? It promotes prevention and lifestyle improvement. You've seen it, by promotes prevention of lifestyle improvement. One, we say holistic care, mind, body, and spirit. Yeah, you get it. And then it focuses where say the thing in Jamaica with our baby too. Yes, you see, even Jamaican uncle can detach in that. Now, uncle, you understand. At least now you understand that that thing is medical. And you see, it was given by us by our forefathers. Let's continue. Relieves pain, stress reduction, and improves well-being. You get it? This is like improving some lifestyle. Often has few side effects when used correctly. There are some people, when they come to hospital, you can give someone medication. The conventional one, that the one that we use in hospital, you can give someone medication, and this person will go and overdo the medication so that he or she heals faster. If you give this person 2 tablets per day, this person will want to use 2 in the morning, 2 in the evening. Those are 4 tablets, and then they become toxic. But it is very, very hard to get something going wrong with overuse of our traditional medicine. You see, and also it supports mental and emotional health. Now, what is the relationship between complementary medicine and conventional medicine? Complementary, we have seen it's not only the herbs, and we are going to talk about them today or tomorrow if time don't get in touch with us. Relationship between complementary and conventional. Complementary medicine is used alongside conventional. Sometimes we will see how as the topic goes on. Yesterday we could not start this topic because I was so busy, but today we have started it, and you see we have to finish complementary and conventional medicine this week. Now, many hospitals now integrate both treatment. You will attest to me, some hospital integrate this treatment. We will see how. We will see how. Patients should always inform healthcare providers when using the therapies, because when you go to hospital, you will be asked, have you ever used? And you will say yes. Now, Before we continue, I want to give the differences, the major differences between the conventional medicine and complementary medicine. The basis, now the aspect, the base of this conventional and complementary. The ones that we use in the hospital are scientifically research proven. They are scientifically research proven. And we have the ones that our forefathers passed to us, that the herbal, through experience, traditional and holistic approach. Because someone has used this tree for long. Let's say for men, the digitalis plant, and this person got healed on prostate cancer because it was benign. It was not metastatic. It was not hyperplasia. And this person got healed. And someone else did it and he got better. And someone else did it and he got even better. And you see, this is a plant. You will not overrule as a doctor that this plant cannot treat. No, you will not tell people that you know better, you studied which drug that is conventional. No, you will advise as this complementary medicine, the herb that we were used, and it will be used as assimilated to the conventional medicine. And now let's go to focus of conventional and complementary medicine. Disease focuses on treatment, that is conventional. If you come in the hospital and I see you have fever, I'll give you paracetamol for the fever to come down. If I see you have malaria, I'll get a drug called digoxin or attenuate lumefantrine to kill that protozoa in your body so that you get better. You see, and if you come with pneumonia and it is bacterial, not viral, I'll give you an antibiotic. And but in complementary, in our traditional medicine, most of them, because you don't know the parasite, it's not the laboratory proven that you have this. It focuses on whole body wellness. The body should be well, no fever, no pain, no everything. You see, you just give the drug, and you see this drug will kill what is giving you fever. It will kill what is giving you the stomach problem. It will kill, but you see you have malaria. But now they have not proven the same thing. But in hospital, you come, we give you, if it is fever, we give you paracetamol. If you have malaria, we give you attenuate, anti-malarial. That is the difference when it comes to focus. Disease treatment, focus. And the other one is wellness, the whole body. One drug that can cure the whole body. Regulation. The drugs that we use in hospital are highly regulated. Why should I say that? It's because if they are not regulated, they are derived from the plant. The same plant that is giving us the complementary medicine. But we get a sample. You see, a plant has carbohydrates, the nutritional part, but there are some other elements in that plant that we can get for treatment. So something like antimalarials, like attenuate, which comes from attenuate plant, we derive that attenuate from that plant and leave the other things. So if this thing we have derived in little milligrams, we only give like 400 milligrams and you take a lot, like 800 double. Hey, your liver will suffer when it comes to metabolism and we get shock, and it can be fatal. So we have to highly regulate these substances because they are highly manufactured and the molecules are highly produced. Now, we have another one called the conventional. Most of them are less regulated, you see, because you know this thing. When I take it, I really applaud for my friend Marwa. He says always on camera that if you take this drug, your stomach is good, and I attest, because they believe it works. You see, even in the Middle East and in the Asia, in the South American countries, you will find these practices. So the most of them are not regulated because you can get them when you want. You go to the farm, you go to the bush, you get them. So you cannot regulate. The only herb that is regulated is marijuana. Hey, hey, Rastas tell me that it's a holy herb. It's only used to to meditate. But remember, our most of the drugs that you use, they are called cannabinoids. They come from the herb itself, my friend. Anesthesists use it to kill pain, mm, to drop the cancer progression. Let me go not so fast on that. We'll discuss one day. So let's continue. Use of these drugs. You'll get it. It is primarily treatment. Primary treatment. Conventional. Primary. You've gone to the lab. You've tested. Yes, this is bacteria. So you get an antibiotic of choice. If it is gram negative, you use an antibiotic which can act on gram negative. If it, the bacteria that is disturbing you is gram positive, you go to the antibiotic which can kill a gram positive. Primary treatment. It is not stripping the whole body, it is removing specific. But here we have complementary medicine. Whatever that I've talked about is supportive treatment. The whole body to feel nice, your mind, your brain. At times I feel I'll go visit because I do this some research. I'll go to South Africa. I don't know if they are still there to visit that person called the Sangom so that I can see how they behave. In Kenya, we had the traditional healers. There are some people in I don't know if uh, we have them, but we used to have some people that when you meet them, they are called the evil eye bearers. I used to go to my rural home, and I was told by my grandmother that way far, a long time ago, she's not there right now. Uh, you don't wake up early in the morning and go to the roads. You will meet women that have bad eyes and you will be sick. And I was wondering, what is this bad eye syndrome? Why is everyone telling me don't meet such a person, don't drink milk? So I suppose that it was something, a syndrome, and the only person that could heal that syndrome is one person in the community that is very respected. And what this person could do, he could mix some plants, say around some words, and you are sprinkled with some water, and then you come there from that place and you feel you are okay. Holistic treatment. Yeah, holistic treatment, the mind, the brain, and the spirit. Yes, you see, it is very interesting, eh? And that's why I say I've not gone for so long. I will do a research on this and I'll visit these people. I'll visit the traditional healers and I'll interact with them. I'll see how they remove the spirits. And you know, in the communities, these people are very respected. Why? One, because when they tell you this plant will heal your diarrhea, it works. When they tell you your headache will be treated by this, it works. So, when it comes to herbs and conventional medicine, doctors don't overrule the herbs and the complementary medicine. You have seen the complementary medicine. It's not only the herbs. We have practices like yoga, acupuncture, the chiropractors. You get it. So we there are some traditional practices as I continue, but please ask any question. Give us your word. Tell us, I used this plant and it healed me. How did it heal me and I didn't go to the hospital? Let's interact. Now, I've said this and I want everyone to understand about complementary medicine. In the way before, our forefathers didn't have hospitals. They had herbalists. And these herbalists were given that mantle from the main herbalists that were there for. So there is some people who paid the price. Because when someone was sick in the early centuries, they could go for every plant. They could go for every herb so that this person could heal. But when they come and reach on a one herb that is treating a symptom like headache, they would always go to that plant. And you see, those are centuries. They always go to that plant to heal this symptom. So you, at the 20th century going to the 21st century, as a doctor who have been trained 7 years and gone for an intern and you have an experience, you will not overrule something that was passed mantle from a generation to generation and it is working. You only need to take that plant, go to the laboratory, find the component that is healing. Find the component in that plant that is making this person heal that symptom like headache, produce it as a tablet, bring on the table. Nowadays, you have to have very many licenses to acquire a drug and say that I discovered. So you see, so I cannot say that because attenuate is treating malaria and we have the tablet, I overrule a person who is using that plant. The only problem comes in is this. Maybe that plant has another side effect. That plant, you get it, but you see, our forefathers used it and it worked. Another generation used it and it worked. You are another generation and people are still using it and it works. So who are you to overrule it? You are not. You should educate. Tell this person that we only use the component that treats and we measure the milligrams according to your symptom and what we have got. Hey, let's continue. Let's continue. It is very important when it comes to traditional practices, when we talk about the mental health and stress control. Why I say it? It is very important when it comes to pain management. I know some of you that I'm talking to right now, they had you were steamed one day when you had a flu. You were steamed one day when you had a flu. So you will not tell me that you didn't pass through that. It is you passed through it, and it is important that we know. And I'm trying to figure out how to this. I'm trying to figure out how to present some images. Let me see using this so that we can learn some images. Let me see. Yeah. Someone seeing, if you are seeing an image, please tell me. If you are seeing an image, please tell me. Put it in studio mode. Cameras. If you are seeing any image, please tell me. We are streaming. Okay. Okay. If it will not happen, I will broadcast them tomorrow. Yes. So we were talking and we were saying, and you cannot overrule a person. Yes, it cannot. It has stopped. Okay. You cannot overrule the progress of our forefathers. You see. So here, pain management, it helped us by massage therapy, yoga, herbal remedies, soaking your body in steamy herbal remedies to relieve pain. If you go to many cancer patients and patients that have continuous headaches, they come, we give them paracetamol, we give them morphine, we give them some other drugs, we give them drugs that we see they can help. But when they are home and the pain is not stopping, sometimes pain can be crucial. You are given medicine, but this pain is not getting where you want it to go. You have to use traditional healing methods and you feel better, like herbal remedies and dipping yourself in the herbs. They were really used and they were effective when it comes to chronic back pains, arthritis, cancer-related pains, headaches, and migraines. The acupuncture. There was a practice for sometimes back, I think the 19th centuries, where not even the 19th, sometimes back, it was the mother of pain killing, of headache, whereby they could put a bell on your head and then they beat it so that you hear those vibrations. And as the vibration hit the head, you see, the pain subsided. Those practices worked. Those practices worked. Today, I've just said this is a very broad topic, and I will come with images and I'll show you how the plants that you always see, this is just a plant, it's a treatment plant. But I will tell you why we limit their use when it comes to hospital. You get it? We have yoga, relaxation. When a person joins a yoga class, or those days when people were used to meet, and then the healer is training you on these yoga practices, there were relaxations, relieving the stress of your body and mind. You get it? Relieving the stress that inside your mind, what is inside your mind. Eh? Now, acupuncture is a practice. I think it's an ancient practice where they get pins and then they puncture somewhere that is swollen. And we said, you remember our talk is when we said inflammation is swelling, hotness, redness. You remember that? And all those. So when you are punctured, some fluid comes out of the place, and then inflammation tends to reduce. You see? And then we go to the mental part of it, where we come to mediation, relaxation, therapy, mindfulness, and music therapy. Music therapy is essential in the environment. That one is me. I attest to it. When I'm stressed and things are not working out, music is everything. I know every time I feel I want to relax my mind, music is everything. So they were used even way before, way before, and most of them were used to people that had depression, stress disorders, sleep problems, and anxiety disorders. You get it? Those are the problems that you are used. And even currently, when we have cancer cares, you'll get chemotherapy, nausea. There are some herbs that we use at home that help. Fatigue. When you are so fatigued, there are some herbs that you can use and you get better. Pain relieving, emotional distress. There are some things you can use the herbs. I will, this week as it goes, I will show you those plants. I'm just trying to know how to broadcast here so that you will see them. Example, acupuncture for nausea. You see, when you feel you want to vomit and then you give it some acupuncture, then inflammation starts and then the nausea gets down. Massage for relaxation and herbal supplements. People still use moringa even now. Moringa. I will show you this week all those drugs. People use moringa. Rehabilitation and chronic disease management like physiotherapy, yoga, and nutritional care. Evidence supporting complementary medicine is very important. Scientific evidence vary depending on therapy. Evidence is time and experience plus results. You get it? So when it comes to herbs and practice, if you were trained by someone who passed to you who is an old man, I will say you know it right, because you have said evidence of complementary is time through generations plus evidence plus experience. Some complementary therapies have strong evidence, very strong. And you attest it because I've said about the baby from the right hand, and the Jamaican uncle here have attested to it. Not knowing that it was medical, The practice, which is traditional, now turns to be medical. And this week I will come out with very many things that are medical, that are traditional practice plus the herbs. While others have limited emergency evidence, some others have limited emergency evidence. So we will see which ones have limited emergency evidence. You see, complementary therapies with strong evidence. Let me try and see some that have strong evidence. Acupuncture, the pinning, the puncture, where there is a pain, you puncture. It heals chronic pain, and I will explain how medical it heals. Remember, today we are just doing an introduction. Migraines helps in acupuncture, the pinning and slicing the place that is. I will show you how. Osteoarthritis helps in acupuncture because of relieving pain. Postoperative nausea, the drugs that we use to relieve nausea, we will see which communities and which one they use. Mindfulness mediation. You remember when some conflicts are at home and we have the old guys, they tell everyone to come around and then we discuss how to bring things down, and yeah, stress relaxing, anxiety, blood pressure control, improving quality of life, because you've gone to a traditional healer and your mind tells you that that is the only person that can help you, that is the only person that can make you feel better, and you go home and you sleep and your anxiety release goes out. You attest that he is the only person that can give you the right medicine, the right herb, and you feel better. The anxiety and stress goes away. Physiotherapy and exercise, rehabilitation after injury. It helps arthritis management, stroke recovery, chronic pain management. You saw even our forefathers had these physiotherapies and they worked. Today I will not go to pros and cons of it, but I've just mentioned. Now, sources, I will introduce now the main part, facts on herb medicine that we will, herbs that we will be talking on about tomorrow. And these are the facts. Herbal medicine is the use. Remember, I was introducing, but from tomorrow we are going to, if you are listening and you have a question, please come on, give me the question. I'll answer. Don't fear asking any question. I say you can ask a question and it enlightens me. Herbal medicine is use of plant extracts to prevent or treat disease and improve health. It is one of the oldest form of healthcare. But you see, the sources is not only the plant itself, the leaves. We have the roots like ginger, we have the leaves like mint and neem, we have barks like cinnamon. Even cinnamon is a medicine. Tomorrow we are going to see how this cinnamon treat. Flowers, e.g. chamomile, flowers is a medicine. Common ways herbal medicine are used, those barks and teas and decoctions, powders, capsules or tablets, oils and creams, raw plant itself, you get it. All this, but you see, the common plants, we should understand, I'm introducing about herbs because it is part of the complementary medicine. I'm introducing about herbs, or we will start it tomorrow about herbs. I'm just introducing. We have ginger. Ginger, it is used to reduce nausea and digestion. Do you know why? Because when you take ginger, and you see it didn't start now, even for pregnant women, when you are in bed and you are nauseated and you feel like you can't, you wake up, you take some ginger, you wait a bit, it increases the motility, it increases how digestion goes and how food goes to your stomach. It goes faster so that you can reduce nausea, because nausea comes to remove food away from the stomach. So I'll say ginger increases motility. Garlic, what do garlic do? May help lower the blood pressure and cholesterol. And sometimes it relaxes your smooth muscles. and your airway going down to your stomach there, some smooth muscles are there. So when it relaxes, even if you have the tight nose, what does it happen? It releases. The menthols, they come from eucalyptus tree. The only thing they do, they have they release the histamine and they relax the smooth muscles. We have aloe vera. We will talk about aloe vera, helps wound healing and skin condition. So we will say our traditional antibiotic was aloe vera, because for a wound to heal, it should be away from bacteria. So that they cannot eat the wound. So what do we say? Wound healing. You get it? Wound healing as an antibacterial. Chamomile, I call it chamomile. Chamomile uses for relaxation and sleep. So what does it do? It is CNS suppressant. It works on the central nervous system so that you can get drowsy, and sleep. Turmeric, what does it do? Anti-inflammatory properties. So we will call turmeric our paracetamol because our paracetamol is an anti-inflammatory. And then we go to eucalyptus. Eucalyptus it releases cough and respiratory problems because it stops histamine release. Tomorrow I'll talk about it. You see how things are very nice when you link up. So I'm doing this topic because I want people to know that we don't contemplate of ruling out the use of herbs. No, they have their own medical part, and they have been used. And what we are using now, even in hospital, is as a result of a result of the herbs that our forefathers were using. And that's why we said it is called complementary medicine, and it's not called herbs only, because we have practices in the medicine. Even in our practice as doctors, we have some other practices like physiotherapy, surgeries, that are not only medicine. You get it? Reasons people use herbal medicine. Why do you use herbal medicine? It's an overview. Today I'm just giving an overview, but I'll go down. I'll tell you about herbs in Asia. I'll tell you about herbs in Kenya. I'll tell you in Africa and even in southern Mexico. Ovedian practices that people do. Cultural and traditional beliefs makes a person use herbs, because their tradition, if you don't use herbs, you'll have a problem. So you have to use a herb. Perceived as a natural and safer way, because someone went to hospital and he was overdosed and it became fatal. This person stayed in hospital for over 1 month. So when you go home, your painkiller, your anti-inflammatory, which is turmeric, instead of using paracetamol to get a problem from your liver for toxins, you use turmeric and it works. So if it is working as an inflammatory antipyretic and your fever is going down, who are we to tell you not to stop using it? Use it. Perceived as natural and safer, accessibility and affordable. Nowadays, some drugs are so expensive. The process of generation of those drugs that we use in hospital is a very expensive affair. Mostly when it comes to drugs called monoclonal antibodies that we use for cancer patients. Very expensive. So it turns away patients and they start using the traditional ways. If you know the plant that is used to produce a drug, why don't you use that plant when you the only thing that you will not know is the dosage and the side effect. Okay? Used to manage chronic illnesses, mostly when it comes to pain, used for prevention and wellness. Those are the main things. And you see, there are some, as I've said, the evidence about the herbal and complementary medicine. Some herbs medicine have scientific support. Some have scientific support. Others still require more research. Effectively may vary depending on preparation and dosage. And then there is the safety part that I will say as we end this video. And as I've said, it is just this topic was supposed to be yesterday, and I have introduced it. So tomorrow we are going to see plants. We are going to see some things that how they work, and are they really helping us as in our body as the way you will go to a hospital. I know this introduction has helped you to understand the meaning of herbs and complementary medicine and conventional medicine which we use in hospital. So if there is someone who is here and has a question, I'm giving some 5 minutes at least so that we can interact and see where to go. So those are the things that we yes, yeah, Elaine, yes. Those are the things that we discuss. If you are using a herbal medicine, and it is helping you, and you visit a doctor, or someone has advised you that my grandfather used this and it helped, and you are using and it is helping, and you are in a condition. If you visit a hospital, don't fail to tell the doctor, I'm using this plant, this drug, and it comes from this plant. Because this doctor can help you how to continue with it while you are using the main plants that we use. I personally, when a patient comes to me for support and tells me that I've been using this plant maybe for cancer, I don't overrule. I just ask that patient, do you know the concoction or the drink that you are taking, the plants that this drink come from? If yes, I go and research on it, and you will find so much it is experience and time proven. So you'll know how to manage your drugs plus but if it has a bad side effect, you will advise the patient. So tomorrow we are in the road of the herbs and the practices of complementary medicine, because it's a confusion when it comes to the conventional medicine, the one used in hospital. So we start with the complementary medicine. We want to know how the herbs were derived. We want to know how these drugs work on our body, and we want to know which herb assorts which symptom, or which herb helps in which dimension. So thank you very much. I see we are going to almost 1 hour. Everyone who has come to listen to me, it is very important. I know this has been a very funny discussion at times, but right now, as the discussion has started, some people are enlightened. So we will continue with it tomorrow. As we continue with it, we will discuss and we will know plants and which plants to use when it is. And please, if you have a plant that you use in your community and it helps, and it is a controversial plant, please tell me. I do my research. Although we have done in complementary medicine more plants and are under research, and most drugs that we use in hospital are derived from the plants that are controversial also. Please don't fail to tell me so that we do researches on them and we enlighten each other. Have a nice day, everyone, and nice evening, everyone, wherever you are. And we will continue this topic tomorrow. Good time. Be blessed, everyone. I see today we have not had any question, just an interaction from Jamaican Uncle. Bye bye. See you tomorrow.